Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Amanda Kuttenkuler. She's the Director of Outreach and Partnerships for the Arkansas Rural Health Partnership. Amanda, thank you so much for being here.
Thank you so much for having me.
So let's start with your work. Tell us about your role and how your work supports healthcare workforce development in rural Arkansas.
Okay. So in my role with the partnership, I focus on connecting education, workforce, and healthcare partners so we can build stronger pipelines together. My work is really about bringing people to the table, creating training opportunities, and then training those people and using those relationships to put people into career pathways to keep our talent local.
And what's the biggest challenge right now? What are you seeing?
That's a loaded question. I think the biggest challenge right now is that the shortages are layered. It's not just one area, it's across the entire system. And that creates a ripple effect in rural and Delta counties. On the physician side, we continue to see real gaps in primary care, OBGYNs, behavioral health providers, and many Delta counties have no obstetrics services at all, which forces expectant mothers to travel long distances for care. Mental health is another huge need. Most of rural Arkansas is designated as a mental health professional shortage area or a desert, according to some federal entities. And then there's nursing. We constantly hear from hospitals and clinics that they can't hire enough nurses to staff their units. And that shortage trickles down into the home or into home health and direct services, direct care, especially for our aging population. And we know that population is just continuing to grow. Emergency care is another pain point. Right now, all 75 counties in Arkansas have ambulance deserts, which means that there are areas where it takes longer than 25 minutes for EMS to arrive, which, can be the difference in life and death in a trauma or cardiac event, which is kind of scary. And finally, I think we need to expand the workforce in ways that go beyond traditional roles. For example, community health workers and care coordinators, navigators can help bridge the gap, helping patients navigate the system, manage chronic conditions, worry about their insurance coverage, Medicare coverage, Medicaid coverage, and then helping them stay connected to services in their area. That's a huge piece of keeping people healthier and reducing pressures on our hospitals. The value of that is huge. And then, so the challenge isn't just filling jobs, it's creating a pipeline, supporting the workforce we already have with more training, like trauma training for nurses and doctors, emergency care. And then building out new roles that can really extend into rural communities.
You touched on this a little bit about building new roles. What efforts are underway to build a stronger pipeline of local students and professionals into those roles, and how can we keep that talent here in Arkansas?
Well, anybody that knows me knows I have a saying that I say all the time. They're probably sick of hearing me say it, but when it comes to students, it's early and often. And I think we're very intentional at the Rural Health Partnership about introducing healthcare careers to kids before they even get out of high school. We'll often bring our mobile unit into districts and let students feel, see, touch, that tactile stuff of what those mannequins or sim things might look like. They love to see, we have some trauma mannequins that show like an eye injury, and they love to see that kind of stuff. We'll take our iPads and let them really look at, we had a surgical competition one time, on the iPad, and it's a lot of fun for them to do that. We've also built a workforce website that highlights rural people from the Delta sharing their career stories, how they got started, what their day looks like, where they went to school, and then linking that directly to training programs and colleges where students can take that next step. So if I'm interested in, say, a nurse anesthetist, I can look that up. And I'm going to click on it, and that's going to be somebody that probably grew up in the same town I did or very close to where I am. They lived like me. They look like me. They may be their family may have been farmers, and now they've got this job. And so it really helps those students see, I can do that. I can be that. Just because, I maybe grew up in rural Arkansas doesn't mean that those opportunities aren't there for me.
And you mentioned the Rural Health Academy. Tell us what that is. And it's new, you said.
It is new. So we really wanted to find a way to help people where they're at. And we also know that our hospitals need upskilling. The big thing right now, the big buzzword is upskill and cross-training and, that kind of thing. So we opened an academy. We started our first, it'll be a year old in January with our first classes. And so far we've done patient care techs, we've done medical assistants, we've done a phlebotomy class. We have done upskill training for other hospitals. So one of the things that's really neat is if I have an employee at the hospital that is a great employee, they might have worked there 5 or 6 years, but they're not, say, a trained patient care tech. And I really would like them to be, because that patient lives there. They've been there forever. Their families aren't moving. I could offer them their a patient care tech class, so that they become certified. And then our patient care techs can do all of the normal patient care stuff, patient movement. But ours also can do phlebotomy, and they can also do EKGs. So now I have one employee that can do 3 different things. So that makes them not only marketable, but more valuable as well, to my institution. The other thing we do is we offer scholarships through some grants through the Department of Labor, where we are able to make new patient care techs and new medical assistants. Our class sizes are small. We're able to reach people. They can do some online stuff. They do some, of course, the checkoffs and all that have to be done in person, but we're able to really combine that. So, we can meet someone if they're in Crossett, even though we're in Pine Bluff. And a lot of times we will go to the hospital, like we might go to Ashley County Medical Center and check off there and do their checkoffs. So people really are learning in their environments, in their communities, but they're getting this good quality training. Our instructor is great. She's young. She's very excited, and she's bringing the latest techniques and instruction. So it's been really good to watch people then get it. And we've had some who they did it and they said, I love it. I'm going to nursing school. And we have a couple now that are going to nursing school. And then we have them positioned in different hospitals and clinics. So, our MAs work a lot with our federally qualified health centers and in clinics. So it's been really neat to watch all of that happen.
I mean, it sounds like this is a potential game changer for these communities, rural communities in Arkansas, to not only train, but to give them an opportunity to stay there and work and invest their lives in the communities there.
It is. And, the other thing that is so good about it is, we're bringing, it's not going to be just in the Delta. We don't have to go through, we work side by side with our community colleges, and we can talk about that later with some of the partnerships that, we had talked about. But so we're not replicating services, but we're doing things that they're not doing, particularly because, I have been in higher ed for a long time. I have to have a certain number of people to make a class worthwhile, or to make a class. I've got to pay everybody, right? And then to add a new class, I have to reach certain target points. So what we're able to do is say, oh, you only have 6 people that need upskilled. That's fine. We can come do a quick, 5-6 week training program with your people at, we're in Batesville right now doing a class, and we have a student there, and we're going to do some for Jefferson Regional. And the great thing is we can do that all over. And we're talking to some other places, throughout the state. So it's not just a Delta problem. It's not just a Delta area, a regional problem. It's everywhere. And so we are hoping to be able to, for lack of a better word, take that show on the road eventually and really meet people where they are and be at other sites and do other things.
And you mentioned community colleges. Is there partnerships with community colleges? Is it across the state?
Yes. So right now, our partnerships with our community colleges are in the Delta area because it is through a grant program through the Department of Labor, and you had to have an area, and that's where we started. That's who we are. So, but we're working with, I want to say 13 colleges. We are giving money to those schools for their students to do EMT and paramedic programs because we know there's such a shortage. We know transportation is going to be such a big deal. I mean, rural transportation is always a big deal, right? I mean, it's a long way from Dermont to Little Rock. And so, or even if you're going to Jefferson or something like that. So we know that's a big deal. So we are paying 100% of the students' cost. So tuition, books, fees, uniform, shoes, basic, like EMT kits, all of that. And we're using several of our colleges in the region. I don't think there's a college in South Arkansas. I mean, we've got some at EACC, UAM, the Fire Academy, SAU. I mean, we really are using all of our community colleges for that. So I think we've got over 200 students in that program. So it's been a really great program. And then, of course, some of them are already, volunteer firefighters who might need that credential to be able to drive the ambulance or to do more. And so we've really been, I think, making a difference in those communities, bringing those people in.
So one last question. What can local healthcare leaders, educators, and even community members do right now to help strengthen the healthcare workforce?
So I think right now, one of the things they can do, it is really important to focus on building and supporting that pipeline. That means creating opportunities for young people. And even adults who are currently working or looking for second careers. I mean, we've got people, all kinds of people in their 40s going, I want to do something different. I want a different career. I'm leaving whatever I've done. I want to do something else. So how do we make those options? Sometimes that might be as simple as inviting students to hospitals and clinics, EMS stations. They used to say, oh, we can't do that. They're not 18. We can do that. We can find a way, to make that happen. It sounds really neat to say, oh, I think I want to do this. It's a completely different thing to watch people do that and watch them work. They need to be able to picture themselves in those roles. I've got a son who's in college who is so excited. He's going to have over Christmas, there's something he's going to do, as an internship. He's thrilled to do that. And I think these young people really want to do that. I think educators can strengthen that pipeline by connecting classroom learning to real world careers. There's a place for everything that we're doing, and educators are fantastic and wonderful, and they have a lot to do every day. But even as younger people, how many people have you heard when they're young, I want to be a firefighter? Well, let's capitalize on that. What does that look like? I want to be a doctor. Well, what does that really look like? And I think we can start that from very, very young to even through our high school and let them see what that looks like, what those real world careers look like. They can also partner with programs that offer certifications, dual enrollment, job shadowing. There's no reason that a student couldn't come to a program like we have at the academy and be able for one semester to do that. And we see that in lots of places, but we also know that there are places that aren't doing that. So, find someone that can help. And the one thing I would say to educators, and I've been there, is we don't know until we ask. The worst someone can say is no. The worst that can happen is you call your local hospital, clinic, academy, whatever, and say, hey, I really want to do this for my students. And they say, no, sorry, we can't do that. Okay. Right. So don't be afraid to pick up the phone and do that. I think healthcare leaders, they need to look at flexible scheduling, apprenticeships, which we're doing a lot with apprenticeships right now. It is a whole new facet that is really being revived again, especially in the healthcare sector. We've always seen them in what I call hard trades, welding, automotive, and now we're really starting to see them in the healthcare sector, and we're working with that a lot, and a lot of people are really open to that. So I think mentorship opportunities that keep people in the field instead of losing them to burnout or relocation. We know there's a study out there that says, for instance, like in education, we immediately give someone who is a brand new teacher, someone that is like their buddy teacher, right? We do that with some nursing programs. They have people after they get there who work with them. And I think we need to do that everywhere. Otherwise, I know sometimes in my job, I feel like I've been thrown to the wolves, right? Like if I had somebody that said, okay, this is what we do. And it's things we don't think about. I do a lot of soft skills training, and, okay, if the phone rings, you're supposed to answer it. Okay, how? Where? What do I do? How do I do it? How do I chart? What is that supposed to look like? Because it's as different from one place to the next as night and day. You know that, and I know that. So I think really offering that, and then, we want to keep them close. And I think community members play a huge role by supporting local hospitals and clinics, encouraging neighbors to pursue healthcare training, even volunteering or just spreading the word about programs that exist. When a community takes ownership of growing its own workforce, you don't just fill jobs. You create a culture, that keeps people working, living, and serving in their hometowns. And that's where the real impact happens. That's where the real change and, the magic, like I like to call it, is. And it can be something like, your neighbor across the street who recently had a procedure done at your local hospital who says, I went and it was fantastic. And, they had all these people there that were helping me, and I think I'm going to go volunteer. We don't tell people about the good stuff enough. I mean, when you read something online, it's all bad and all the bad things that happen. But we need to really start creating that culture where we're telling people, especially youth, the good things. We don't tell our own stories enough, especially in rural. I think we think, oh, it happened, I have to go back to work. We've got to tell those stories and be responsible for making those stories important.
Well, Amanda, thank you so much for sharing your passion, sharing these incredible partnerships and programs that are happening. And I appreciate you being here today.
Well, thank you so much for having us or having me. And I'm very excited to talk about my work. I'm still one of those people that's lucky enough to love my job. So anyway, I look forward to talking with you all in the future.
Well, it shows that you love what you do. And I appreciate you taking the time. Thanks so much.
Yeah, thank you.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.